Hello, everyone. I am Ritumoni and I'm a state consultant social protection and gender programming for UNICEF Assam. And the title of my project is Enhancing Women's Agency at Grassroots for Improved Maternal Healthcare. The project aims at creating tools and designs that are applicable for government to implement what's increasing reach and coverage of maternal and child health care and including maternity health benefits, a strategy for pre and during disaster phase for preparedness and timely deliverance is developed. The main objective is to ensure that frontline workers are linking women to maternity benefit scheme and services that they are entitled to. And to do this, Anganwadi workers are to be trained with a toolkit, and the NSOP is to be developed in consultation with state and district officials of departments such as Department of Women and Child Development and National Health Mission to create that for the consultation a bottleneck assessment on or to create an evidence to advocate further with the government is also done. And the idea would be implemented as a pilot in select districts initially, and later on, the learnings would be included in scaling up the project. Why it is important? Assam has an annual occurrence of flood with more than 40% of its land susceptible to flood damages. Assam also has one of the highest MMR, and flood doesn't only lead to money and property loss; it also leads to reduced access to healthcare due to damage of roads and health facilities. And disaster is major impediment to ensure timely delivery of services, and health and nutrition of pregnant women are often neglected during flood. To ensure that pregnant and lactating mothers in flood affected areas are monitored well and are linked to the services, pre and during disaster phase plans and actions are important. Maternity benefits can also enable women to have access to monetary benefits during pregnancy and in an emergency situation, which can help them which can help them in availing and emergency care services. It will be how the project has been implemented. First, an assessment has been conducted on in flood affected area. Anganwadi workers, supervisors, and district officials were interviewed. Using the data, I advocated with the government departments, Department of Women and Child Development, on the integrating a disaster lens in their programs. Then developing a pilot phase model for 5 districts and designing of tools and standard operating procedures for the training of the district and state officials on monitoring and handholding and training of frontline workers of such as Anganwadi and Ashas, and finally rolling out of the toolkit and SOP in pilot mode initially. So some of the early findings of the bottle of the assessment has been that there is a gap in understanding on how pregnant women are to be reached in emergency situations such as flood among the frontline workers as well as the supervisory staff. There is also handholding and monitoring gaps from district team and supervisors on actions prior to and during flood to ensure that pregnant women are registered availing ANC and registered for maternity benefits in flood affected areas on time. The early results has been that I have been able to integrate it within the implementation mechanism of maternity benefit schemes such as Pradhan, which is a conditional cash transfer that with the conditions attached that the pregnant women would get a 5,000 rupees as in their for the first born when they would adhere to certain conditions such as they are registered for their pregnancy and they are availing ANC services. So I have also designed a tool and SOP for implementing such schemes in flood-prone areas. I'm hoping that this would pave the path for more shock responsive design in implementing social protection and mental health services in flood and disaster situations. With that, I have also learned a lot from the leadership journey. And while doing this project, I've understood my own strengths and weaknesses and how I need to build and strengthen my knowledge on the subject matter itself. I have worked and made the government alive from the beginning, frontline workers and community from the beginning to understand their needs and also to work with them in implementing this project. Then strategically, I have included gender lens in the disaster, ensuring that frontline workers are not overburdened, but the project is aligned and integrated within their work profile. and to look into the impact is to be looked into how maternal health care services are delivered in disaster situations, and disaster lens is integrated in deliverance of maternal health services, including maternity benefit schemes. So I'm working towards integrating in other program designs as well, and I'm hopeful that this pilot phase would scale up to implementation in other districts as well, with positive results. Thank you so much for your patient hearing. Thank you.